If you're experiencing uncomfortable pelvic pain with being intimate with your partner, or if you're getting a lot of constipation, you may have tense and tight pelvic floor muscles, these muscles in red. So today in this video, if you have tried other methods, but you haven't done specific exercises to assist with helping relieve constipation or pelvic pain, I'm gonna talk you through that today. My name is Dr. Dawn Andalone. I'm a pelvic floor specialist, and after helping so many women with pelvic floor issues, it is very common to experience constipation or even pelvic pain when these muscles are tense and tight. Now, we often think of pelvic floor muscles as the Kegel exercise muscles when you have bladder problems or prolapse, and you're supposed to squeeze those muscles and really exercise them as you age. You were maybe told this by doctors. But for many women, they have tense and tight pelvic floor muscles, which lead to unwanted symptoms that oftentimes can be really hard to diagnose. If you're experiencing any of that and you're going to the doctor and trying to figure out other things to help it, but is not helped, it may be related to all these muscles. And even the muscles back by your hips that connect to your sacral area, your lower back, anything around the core and the hips, we definitely want to work on stretching and lengthening them. This can help your symptoms. And it's important to do for any woman because therefore tense and tight muscles can't work properly to support your bladder, to support your pelvic organs, and being able to have pelvic floor muscles that are functioning properly as we age is very important for bowel and bladder function, sexual function, and so on. So what I'm going to talk through today is how best to release those muscles so therefore you can ease your symptoms as well. Now we want to increase circulation, decrease tension. So what we're gonna start first is a simple breathing exercise. Sounds so simple, but you can do this sitting up, you can do it standing, you can do it lying down. I prefer because therefore you can relax your back and your hip muscles as well. But breathing is highly underrated, and breathing exercises connect a lot to your digestive system, your pelvic floor and core area, and release a lot of back and pelvic tension. So with breathing exercises, let's start with our lower belly. Our hands are right under our navel, and we want to imagine that you're breathing into your fingertips there. So your belly should rise and fall. If you're taking an inhale through your nose and exhaling through your mouth, and repeating that 10 times, you're going to start to feel a little less tension in your back and even around your pelvic muscles here. So we want this area to lengthen and then relax, but you're not tensing and tightening anything from your pelvic area or your abdominals when you're working on breathing. You can also take your hands around your rib cage. So imagine an umbrella opening and closing, but you're breathing more into your ribs and into your lower back with that inhale through your nose and exhale through your mouth. This is also going to allow more air down into your lungs and therefore translates into the whole midsection of your body and your core and your pelvic floor. When you're taking an inhale, your pelvic floor lets go and relaxes. So focusing on that inhale and taking a good inhale, you may feel those pelvic muscles by the vaginal opening. Thinking of releasing, or if a flower is opening, you're imagining that at the vaginal opening, and so therefore it's taking away some of that tension. The next exercise is a child's pose, and we're going to take our knees kind of wide on this one, and therefore you're going to open that pelvic inlet there, and therefore we are going to stretch and lengthen those pelvic floor muscles. So as you take your knees out wide, you're going to stretch your hands above and then lean back toward your hips and toward your buttocks area, and you can take a couple deep breaths there and then come back over your hands and then try it again and take a few deep breaths here. Now for anyone that has difficulty being on their knees like that, you can also do it standing at a countertop and I can show you what that looks like. So imagine I am standing at a countertop. I place my hands on the countertop in the kitchen, and I'm gonna lean back and keep my knees just slightly bent, and therefore I'm really lengthening that area by my tailbone and breathing into my pelvic muscles. And you can do a couple deep breaths in that position, a flat back, but opening up that back part of the pelvic floor, and then repeating again. If you've ever looked up other exercises, this may be called a puppy pose too, kind of like a puppy sticks its butt up in the air. So that can be in place of the child's pose exercise. Okay, next we have child's pose. This is a common yoga pose. Okay, I'm on my back. I'm gonna grab onto my big toe, and maybe your hips are really tight and this is hard for you to do. If so, you can do one at a time and let that other knee fall out to the side. But if you are really tight through your hips, that may be why your pelvic floor muscles are really tense and you're getting those uncomfortable symptoms. But ideally, if you have both legs up and you're breathing like it's like an upside down squat, and you're breathing into your pelvic floor that way, and you can hold for about 3 or 4 deep breaths there. Okay, next I love a deep squat. A deep squat position may not be great if you have difficulty getting into this position. You can hold on to something and just go as low as you can tolerate if this bothers your knees or your hips. But this is another way. I especially love this for pregnant women too, to try to lengthen their pelvic floor before delivery. But you want to breathe into your lower belly and into your pelvic floor here. I can even push my elbows toward my knees because I'm trying to open up that area through my pelvic floor. So breathing into this position. Last but not least, we're gonna go into a cat-cow. Another great yoga or Pilates exercise, but I'm gonna start on my hands and knees. You can put some pillows or something under your knees if that is not comfortable, but you will find a lot of benefit to all the other exercises that I showed as well. So don't feel like you're missing out, but this is a bonus one. And so inhale, and as I exhale, I'm gonna round up, tucking my pelvis underneath. And then inhale, drop my navel toward the floor and kind of let my tailbone lift. And then exhale, curl up. And you wanna repeat this about 10 times. Now that can be very helpful if you have a lot of tension around your tailbone, and when you're moving back and forth, you're stretching all these muscles here, especially with the breathing. That's gonna allow for stretching around this area too. So thank you so much for watching this. I hope these tips helped you, and try them for the next 10 days. I also have an amazing program to help you with pelvic floor Pilates, and not only will it help strengthen and tone your midsection, but for purpose of this video, I teach you relaxation techniques because that is so helpful for encouraging no bladder issues with leaking or urgency in the future, and also easing back pain. I'll link to that program below. So thanks so much for watching, and we'll see you again in another video.